Doppler quantification is a very important tool in the assessment of rheumatoid arthritis with ultrasound. If I have a patient where I suspect an inflammatory condition, I always use Doppler, whether it's color or power Doppler, to visualize any signs of hyperemia. And an indication of hyperemia from Doppler would be a very important component of the diagnosis. If a patient displays clinical symptoms that appear to indicate rheumatoid arthritis, and synovial swelling is detected by ultrasound, then that is significant according to the new ACR-EULAR classification criteria for rheumatoid arthritis. This is because subclinical disease, as detected by ultrasound or MRI, is considered valid in the count of totally affected joints. Quite recently, we saw a patient who had a lot of clinical symptoms indicating arthritis, but did not have any signs of swollen joints and had never experienced swollen joints. And yet, when we did the ultrasound, he actually had Doppler activity bilaterally, covering nearly all of the fat pads in the 5 MCP joints. That was a very important finding. If I had used the grayscale or the B mode alone, then I wouldn't have had any indication of an ongoing disease. All of this patient's lab results were normal, and he had no swollen joints. He had morning stiffness in his fingers lasting 3 hours, and he displayed Doppler activity upon examination. So based on the Doppler findings, I decided to start him on DMARD treatment. I am often asked to decide if a patient on traditional DMARD therapy shows signs of subclinical disease that could indicate escalation of therapy, for instance to biological treatment. Quite regularly, I get referred patients who seem to have painful joints but no certain clinical signs of arthritis. I then evaluate them for signs of synovial hypertrophy and Doppler activity that could indicate that they actually still have active arthritis despite their DMARD treatment. If so, I can start them on biological treatment. I would like to use ultrasound as a standardized examination for follow-up in all our patients when they start their DMARD or biological treatment. In those cases, I start with a baseline examination by using ultrasound to evaluate a predefined set of joints. I evaluate them for signs of B mode changes and for Doppler activity. Then they come for regular follow-up session during their treatment, and I evaluate whether the Doppler activity and synovial hypertrophy actually diminish while the patients are being treated. If it doesn't diminish, then using those findings, combined with recommendations from clinical studies, I'm able to change their course of treatment and start a new treatment regime.